Welcome to Next Anatomy. Today we will be continuing the discussion of the internal structure of the spinal cord. To have a brief view of the external structure and the features of the spinal cord, do log into the channel and find out the previous videos. And you can listen once and you'll get one idea about the external structure and the features of the spinal cord and its blood supply. In this session, we will talk about the internal structure and also about the clinical anatomy of the spinal cord. So when you talk about the internal structure, mainly when you take the cross section, so now this is the cross section of the spinal cord. And as discussed, so this will be the anterior median fissure and the posterior median sulcus. And at the center, you have the central canal. And we could able to find the anterior root and the posterior root, which makes up the spinal nerve. And then when we see the internal features, we could able to identify an outer white matter and an inner gray matter. We're supposed to keep in mind that whenever you study the CNS, outer and inner, these words are very important. At certain places, it will be outer gray matter and inner white matter. Especially now in the spinal cord, it's made up of outer white matter and inner gray matter. So gray matter appears in a letter H shape manner, and mainly we can able to call them as the horns, like anterior horn, lateral horn, and the posterior horn. I can name them as the anterior horn, followed by the lateral gray horn, followed by the posterior gray horn. And this is our representation of both the sides, which appears the letter H-shaped structure. Also, we have an outer white matter, so I can call them as anterior white column, lateral white column, and the posterior white column. And mainly the gray matter, which includes and consists of nerve cells, neuroglia, and the blood vessels. And mainly anterior and lateral gray horns will constitute more of motor neurons, and the posterior horn involves in the sensory information, forming the ascending tracts and also the intersegmental tracts, which constitutes the sensory neurons. Generally, when we talk about the internal features of the spinal cord, we study by a structural classification and a functional classification. In a structural classification, mainly we identify the axons. And in the functional classification, we talk more about the cells. So long axon things I could able to categorize under Golgi type 1, and the short axon type I could able to categorize them under Golgi type 2. And mainly they leave the gray matter and joins with the anterior nerve root. And finally they forms a nerve tract. Same like as in the functional classification also, we have an alpha and the gamma neurons. And they are multipolar cells which are large under alpha and which are small under gamma neurons. And when we see the compare to spinal cord at different cut section levels of cervical level, thoracic level, lumbar, sacral coccygeal level, shape alters. In the cervical level, it's oval, then oval to circular, nearly circular, and circular to quadrilateral. The outline section varies from cervical to sacral. And when we see the gray matter, the inner gray matter, in cervical and in lumbar and in sacral, it is larger, but in the thoracic level, it is small. And we subcategorize them into anterior horn, lateral horn, posterior horn. In cervical level, the anterior horn is absent, but we can find in thoracic, lumbar, and sacral. Same likewise in the lateral horn also, the gray matter is massive and massive in both cervical and sacral, and little bit slender and bulbous in the thoracic and lumbar. The same pattern for the posterior horn. So almost in short and sweet, I can say that you can remember cervical to sacral, thoracic to lumbar, the features which we could able to remember very easily. When we talk about the gray matter, we said that they includes different cell groups which are in the gray column. So now this is anterior gray horn, followed by lateral gray horn, followed by the posterior gray horn. Can call them as gray column. Lateral one I could able to call them as the intermediate gray column and as usual posterior gray column. Mainly here in the anterior gray column, I have 1, 2, and 3 groups of now cell groups as a medial group, intermediate group, or central group, then a lateral group. And again, we name them by individual cells. Followed by, we have the lateral group, and we had the posterior group. We'll try to name them one by one. So now, as mentioned in the cross-section of the spinal cord of the inner gray matter, the medial group, so now I'm talking about the anterior gray column, about this anterior gray column. In the medial group, I have a medial cell nucleus, both on the dorsal side and the ventral side, named as dorsomedial nucleus and ventromedial nucleus, and they maintains the axial musculature of the neck and the trunk line. And in the central group, I have phrenic nerve nucleus. So now we have diaphragm. When you studied the brachial plexus, we said that the root value C3, C4, C5. So now the diaphragm will be supplied by this phrenic group of nucleus. And also especially in the lumbosacral region, only at the level of L2 to S3 level. In the central group, I have lumbosacral nucleus. And also the central group of nucleus can be seen only at the C1 to C5 level for the spinal accessory nucleus. So this applies to sternocleidomastoid and trapezius when you study the head and neck muscles. So this applies in the cervical region. So we can say C1 to C5 and L2 to L3 level only you will identify the central group of nuclei in the anterior gray column, and at the remaining places you don't identify anything. And coming to the lateral group, same like dorsomedial, here also I have dorsolateral. Same like ventromedial, I also have ventrolateral, added by behind retrodorsal nucleus, and their main function is to supply the limb muscles. At all these areas, we have medial, central, and the lateral group of nuclei. Now, when we move on to the lateral gray column, I have only two main nuclei are there, intermediomedial and intermediolateral. So here you could able to identify intermediomedial and intermediolateral. This level you could able to identify the key important nucleus which mainly maintains the thoracolumbar outflow and the sacral outflow. When you study the nervous system in the nervous system regarding the outflow pathways, there you will get more clarity. What is thoracolumbar outflow, what is sacral outflow, what is other different outflows. You could able to locate at that time in another separate session. And also followed by the posterior gray column. So now this is the posterior gray on the column. So from above downwards, we could able to mention them as the first nuclei called substantia nigra, which is having Golgi type 2. Their main function is to predict the pain and temperature. The second nuclei will be nucleus proprius, which does the 2-point discrimination and vibrations and proprioception. Nucleus dorsalis is the third nuclei, which predicts your touch, pressure, and muscle joint positions. And visceral afferent nucleus receives the dorsal nerves. This is what you will be observing at all these levels. Substantia gelatinosa, nucleus proprius, nucleus dorsalis, otherwise also called as Clark's column tract, and visceral afferent nucleus. So now we have studied the anterior gray column nuclei, lateral gray column nuclei, and the posterior gray column nuclei around the central canal. So now this is one half. And altogetherly, I could able to categorize them in one single channel. I could able to call them by laminae. From the posterior onwards, posterior marginal nucleus, I could name them as laminae 1. Laminae 2, I could able to call them as substantia gelatinosa. Laminae 3 and 4 for nucleus proprius. And 5 and 6 for Clark's column or dorsal column with nucleus dorsalis. And the seventh laminae will be for the lateral gray column, that is the intermediomedial and the lateral medial. And column number 8 and 9, I could categorize them as medial and lateral groups of anterior gray column. And the only 10th that will be surrounding around the central canal. So central canal surrounded by the gray condition as a 10th lamina. So do remember the internal structure of the cross section of the spinal cord will ask in both anatomy and in certain subjects they will be asking you on in histology and also in physiology and in further courses also. It is very important for us to know the nuclei and the laminae of the internal features of the spinal. So as up till now we have finished the gray matter. Same likewise, we will head into the white matter. So now this is the inner gray matter. So now we'll go to the white matter. The spinal cord surrounds the central H shape. So now I'm surrounding the H shaped mass of a gray matter. Here they constitute some myelinated nerve fibers, which are white in appearance. As by anterior gray, lateral gray, and posterior gray, we also name them as anterior white column, which is present between the anterior median fissure and the anterior gray horn. Is all these area I could able to call them as the anterior white column. Same likewise. The lateral white column is present between the anterior horn and the posterior horn. So now this area I'm going to call them as the lateral white column. And the posterior white horn column is be located in the and the posterior white column is located between the posterior median fissure nor sulcus from the posterior horn, and all these area I could able to call them as the posterior white column. And each white column is made up of either sensory nor motor nor associated tracts. And after knowing the internal features of the spinal cord, their nuclei and their tracts, so now we are going to name them as ascending tracts and descending tracts. Ascending tracts can be named as sensory tracts. The descending tracts will be called for as the motor tracts. So now in this cut section photograph, now we would like to show you two halves. At one side you could able to learn for motor tracts, the other side you could able to learn for the sensory tracts. So now here on one side motor tracts and on other side sensory tracts. The tracts are defined as a collection of nerve fibers within the central nervous system, which is referred as a tract. And later on, when you study the remaining part of the CNS, you learn about fasciculi, means bundles. You'll hear another word called as a lemnisci, means ribbon-like appearances. So now here we go to name the ascending tracts. So we start from anterior to lateral to posterior level. So you could able to see the anterior spinothalamic tract and lateral spinothalamic tract, and you could able to see the posterior column tracts named as fasciculus gracilis tract of Gall and fasciculus cuneatus tract of Buddha, followed by on the lateral most aspect you could able to identify anterior and lateral spinothalamic tracts added by spino-olivary tracts. Same likewise, few descending tracts will start from cerebral cortex and descend onwards. And I could able to name them as mainly the pyramidal tract. The crossed fibers I could able to name them as anterior corticospinal tract. And also we have added by cerebrospinal tract. Then we also have medial and lateral cerebrospinal tracts and olivospinal, vestibulospinal, tactospinal tracts. So do practice this diagram so that when you draw it can explain you both the few ascending and descending tracts passing through the substance of the spinal cord. The same was being mentioned here in the tabulation, ascending tracts and the descending tracts, which even passes through the white column, is the same tracts to be remembered. After learning the internal features, almost in the spinal cord, you're supposed to recall about the clinical anatomy. And mainly, we are having the first clinical anatomy, that is the syringobelia. In this condition, what happens here is like at the central portion, we could able to identify a fluid cavity develops near the center of the spinal cord, especially in the cervical segments. So try to see here, this is the normal cervical spinal cord. Try to observe here, there's a fluid cavity. A cavity was being developed, a very clear cavity. So once this cavity has been developed, it leads to the destruction of the cord involving the central canal and its surrounding area. Finally, it leads to the lesion involved in the decussating spinothalamic tracts, leading to both the sides, means bilateral loss of pain and temperature sensations. And this leads to dissociated sensory loss, termed as syringomelia. Another short note question also will be asked, the Brown-Sequard syndrome, and also can be mentioned in the clinical anatomy. So here we could able to see ipsilateral upper motor neuron type of spastic paralysis, especially below the level of hemisection, and mainly the pyramidal tract was involved. And again, same side, ipsilateral loss of proprioceptive sensation. Mainly what happens here is like position sense, posture, passive movements, and all the vibration senses are lost on the same side itself. And also fine touch discrimination due to the involvement of posterior column tracts were being involved. And also opposite side, contralateral loss of pain and temperature. On the opposite side also, loss of pain and temperature sensations below the level of lesion. Spinothalamic tract was involved. These are all of the collective signs and symptoms at the hemisection, as termed as the Brown-Sequard syndrome. Moving on to tabes dorsalis. It's a syphilitic degenerating lesion, especially. So now we already know this is our posterior white column. So now the posterior white column and the nerve roots were being involved in the lesion, leading to the impairment of posterior column, Clark's column tract, that is the proprioceptive sensations. Especially the patient loses the tactile discrimination, loses the vibration, passive movements, and appreciation of the posture. At this time, what happens here is like the patient becomes ataxic. Especially note point to be remembered, when he closes his eyes, he lost his position sense. But somehow he can manage it with by past visual knowledge. So this is the total white column of both the sides was been affected, leading to tabes dorsalis. Anterior spinal artery syndrome. Once in the anterior median fissure, once the occlusion of the anterior spinal artery occurs, leading to thrombosis or compression of the artery, leads to the motor symptoms, especially corticospinal tracts are involved, and the anterior gray column got affected. Motor symptoms. What all the motor tracts that have been passing through, which was already discussed in the past cross-sectional diagram. And also bilateral loss of both the sides, pain and temperature sensations, because you know anterior and lateral spinothalamic tracts. So both the sides, pain and temperature sensation is lost because due to the ischemia of the spinothalamic. See that the spinal cord detailed discussion is completed, and stay tuned to all the further next anatomy sessions, and do like, share, and subscribe, Listen again and again so that you would able to become strong enough in the subject.